Hey guys, welcome to week 2. This week we are looking at body composition and flexibility assessment. So if you're on Blackboard, go ahead and follow along. You're probably already in the week 2 module because that's how you found this video. The overview for the week, basically we're looking at chapter 8 on assessing body composition, and chapter 10 on assessing flexibility and lower back function. Okay. The two things to complete this week are quiz number 2, and then you have a CAP 2, which is on blood pressure, body composition, and flexibility assessment. Okay. So reading materials, as you're watching this video, you should jump into chapter 8 and chapter 10, the PowerPoints that I've provided you on Blackboard. And then you'll want to read through the chapters in the textbook as well. Okay, so you can see I'm going to talk real quick about the quiz and the CAP 2. Quiz is the same format as week 1, so you already know what to do there. Assuming you took quiz 1, again 30 points, you get 60 minutes, so 2 minutes a question. That's about that. So make sure you get that done by Sunday. CAP 2, there is an Excel spreadsheet for you to download that you can see at the top of this as attached files. Go ahead and download that. You'll see in the instructions it says that you will be using the equipment that you were supposed to purchase. You'll need to video record yourself again, like in the first week, but you're going to assess blood pressure, and then body composition. So blood pressure, you're going to need to use your blood pressure cuff. And then for body composition, you will use the skin fold and do the Jackson Pollock's 3-site skin fold assessment. And then, of course, the 3 sites depends on your gender. So if you're male, you have 3 different sites than the female. So make sure you pay attention to use the correct sites. Okay. Then there's a waist to hip measurement, which you'll use just your tape measure for that. The YMCA sit and reach test, and then the goniometer test. So you need your goniometer to do that one for the shoulder, elbow, and hip and knee. Okay, so look at the Excel spreadsheet that's online. It's pretty self-explanatory. You'll see a column for each score, and it tells you what to do. Now, if you're thinking, well, how do I assess these? Well, there's videos for each one. So don't email me saying, Dr. Waite, I don't know how to assess such and such. Well, there's a video that takes you through it. If for some reason the video is not clear to you, I'm sure you could find other videos on YouTube as well. These are pretty self-explanatory. It really just comes down to doing them often to perfect your technique. Okay, so there's one for blood pressure, skin fold measurements, waist and hip measurement, YMCA sit and reach test, and the goniometer test. Okay. It tells you the video recording requirements, just like last week. Make sure that you follow the rubric. You need to identify and describe what you'll be doing, so follow the script on that. And then notice that it does talk about you and your client or patient, so you're gonna both need to be in the video, just like how they demonstrate in the videos provided online. You need to do this on somebody, so you need a partner for this. It could be a sibling, it could be your parent, it could be your roommate, whoever, girlfriend, boyfriend, husband, wife. Like when I was in grad school or even undergrad, I did a lot of these experiments on my girlfriend, who's now my wife, and it's a good idea to find a partner who you can work with and practice with often, and get used to doing these. Okay, so that is basically it for the assignments. Now, if you will, go ahead and click on the chapter 8 and chapter 10 PowerPoints. I'm going to bring those up right now. So if you want to follow along as I'm discussing these, I'm just going to do this real briefly, try and keep this video to 10 minutes or less. So chapter 8, body composition, pretty pretty simple, straightforward. The outline, what we're looking at is how body composition affects health. So there's a review on that. Fat mass versus muscle mass. There's a lot of research that indicates that fat mass can lead to chronic diseases such as like type 2 diabetes, obesity, and heart disease, which is like the number one cause of death in the United States. You know that from last week. We're going to look at patterns of body fat distribution, apple versus pear shape, right? So typical female versus male shape and how we carry fat differently. And then it's going to go into how you assess body composition. It's going to go over skin fold measurements. It's going to go over the different forms of like more accurate body composition testing. So there's BIA, bioelectrical impedance analysis. It'll discuss that. Hydrostatic weighing, discuss that one, and DEXA scans and MRI. Okay. And the last thing it'll talk about is calculating target body weight. So at the end of this PowerPoint, at the end of the chapter, you should be able to know how to assess body composition through the different measures. The one that we're going to be doing for our CAP project is skin fold measurement, which is one of the most accurate if you're good at doing the measurements, if you do the measurement correctly. And then of course there's equations for that go along with it that you'll see in here. And then by the end of it, you should know how to assess body fat, body composition, and you should be able to determine how to figure out an ideal body weight and ideal body composition for a client or yourself. Okay, so that's kind of chapter 8 in a nutshell. I'm going to bring up chapter 10. This chapter I think is much simpler because it's just assessing flexibility. There's many ways to assess flexibility, which is why if you look at the PowerPoint, there's like 36 slides, but it's just showing pictures on how to actually do the measurements and the different types of measurements. So most of it relates to that. But some of the content actually focuses on what influences flexibility and so the factors that prevent flexibility and also the factors that help you become more flexible, like stretching regularly. And different forms of stretching, like PNF stretching, static stretching, dynamic stretches, and so forth. So it starts off talking about like relative flexibility and what that means, looking at range of motion. Now, one of the things that I like to point out to students is that flexibility is what helps us get range of motion at a joint. So when you hear the term range of motion, it's not actually talking about the range of motion in the muscle, because what we do is we assess the flexibility of the muscle, so the ability of the muscle to go through range of motion through flexibility, elasticity of the muscle cells. But then when we talk about range of motion, we're usually talking about the motion at the joint. So if you're really inflexible, so if you have tight muscles, it limits the range of motion at the joint, which is usually what ends up causing injury through repetitive motion. Okay, and then so with the range of motion and the assessing flexibility, you're gonna be looking at the hip, the knee, the ankle, and then upper extremities like shoulders and arms and so forth, and then also the spine, and then it'll finish with hamstrings, which goes into the sit and reach test. So you'll learn about the sit and reach test in this chapter as well. So a lot of students ask me, well, the sit and reach test has been around a long time and it's kind of like an old school assessment, like how realistic is it? I think it's a good assessment for just looking at your overall flexibility because it's assessing hamstrings but also lower back. And typically so the number one medical complaint in the US is low back pain, and it's typically because we sit too much, which shortens our hamstrings. Hamstrings pull on the pelvic girdle, which then compresses the spine and causes pain. And so the sit and reach test is a great way to assess your flexibility and show that compared to the standards and where you should be to prevent injury or low back pain. So this chapter talks about that. You'll get a little more insight on that, but this is basically my version of overview. Okay, cool. So that's chapter 8 and 10. That's what you'll be doing this week. Make sure you dig into that right away. after you watch this video, and start working on your CAP assignment. Find a partner and start messing with the instruments, watch the videos, and by the end of the week, you'll turn in CAP 2 and you'll take Quiz 2. All right. As always, I'll be looking at your submissions online and giving feedback randomly to certain students. Please note that you'll notice I didn't give feedback to everybody in week 1. There's a lot of you and only one of me. So throughout the week, I'll periodically report back to you and give you feedback. But mostly I'm just going to wait till the end of the week to grade it and give you feedback in the grade. If there is concern about your grade, like if you got a low score, look at my comments. It's probably because you're missing something or you didn't do something right. And I'll just remind you of those. And as always, if you have questions about the feedback, don't hesitate to email me. I'm happy to speak with you. We can even talk on the phone if need be as well. Okay. All right, guys, have a blessed week. Looking forward to seeing your submissions. All right, bye.